Goniosynostomosis under intraoperative optical coherence tomography guidance in real time. No financial interest to disclose. A 60-year-old female presented to us with features of acute congestive attack. She later underwent laser peripheral iridotomy. In spite of a patent iridotomy and maximum medical therapy, she had 270 degree of peripheral anterior synechia and the intraocular pressure was 30 mm of mercury. She also had grade 1 nuclear sclerosis with glaucoma flecken. Randomized controlled trials have established the role of cataract surgery in relieving angle closure and had considered intraocular pressure reduction alone as the outcome measure. Is there anything beyond this? Let us have a look. We took up the patient for phacoemulsification and used an intraoperative OCT integrated microscope. Pink line on color image shows the vertical section and the OCT image is shown on the right lower portion. Upper end of this section is on the right extreme of the OCT picture. The green line shows the horizontal section and the corresponding OCT is on the right upper portion. At the beginning of surgery, we can notice that the angles are closed. We can see the intracorneal course and entry of keratome into the anterior chamber. The entry wound is well appreciable. Anterior capsule is well seen during capsulorhexis. Adequacy of hydrodissection is denoted by the bulging forward and breaking of anterior cortical fibers. Phacoprobe is seen in the trench created. Phacoemulsification proceeded with phaco-chop technique. Surgery progressed with irrigation aspiration and intraocular lens implantation. A novel step, intraoperative OCT guided goniosynostomosis is done next. With viscoelastics in anterior chamber, a spatula is inserted through side port to the opposite angle and an optimum downward push is given on the iris at the angle. The difficulty we faced is that the metallic instrument casts shadow and hence the angle structures are not clearly visible when the spatula is at the angle. But the extent of downward movement of iris gave us idea about the optimum force required. One can very well appreciate the open angles at the end of surgery. So, we suggest that goniosynostomosis combined with cataract surgery is helpful in opening up of angles in spite of formation of peripheral anterior synechia, and also to include the degrees of angles opened as an outcome measure in addition to the intraocular pressure reduction after cataract surgery in future randomized controlled trials. OCT guided procedures at the angle do not replace the current practice of using gonio lens, but is an alternative way to approach the angles, especially when the cornea is hazy, as in glaucoma in failed keratoplasty or congenital glaucoma. This is of great significance in countries like India, where almost all congenital glaucoma patients present with hazy corneas. Its use can be extended to micro-incision glaucoma surgeries, tube insertion in drainage device implantation, needling, non-penetrating glaucoma surgeries, and also as a teaching tool. Thank you.